So, you're thinking about a regenerative vaginal treatment. And let's be honest, there's probably one huge question on your mind. When am I actually going to see results? It's the most important question, right? Well, in this explainer, we're going to break it all down with some real science-based answers so you know
for so many
exactly
of
what
us,
to expect on
intimacy
your
can
journey.
get tangled up
And
with
to guide us
anxiety
through
and
all of
pain.
this,
We're turning to the expertise
for
of Dr.
so many of us,
Farzana Khan
for
from
so
the
many
Women's
of us,
Health
intimacy
Clinic.
can get
Philosophy
tangled
is
up with
right there.
anxiety and
honestly,
pain.
it's the key to a great outcome. Clear explanations, realistic expectations, and making decisions together. So let's talk a little more about why Dr. Khan's perspective is so valuable here. I mean, when we're talking about intimate health, having the right expert isn't just a nice to have, it's absolutely essential. Just look at this experience. We're talking over 2 decades in the field. She got her medical degree way back in 2003, spent years specializing in OBGYN, and now she's a key opinion leader, which means she actually trains other doctors on the latest technologies. That incredible depth of knowledge is exactly why we can trust what we're about to learn. Okay, so this brings us right to the heart of the matter. And this is a really big one to get your head around. These treatments are not a quick fix. They're not like taking a pill for a headache. They're designed to work with your body's own natural healing clock. And that process, well, it just takes time. So let's just tackle that big question head on. When will I see results? I get it. When you've been dealing with something for a long time, hearing "just be patient" can be super frustrating. But here's the thing, understanding why you're waiting, that's where the power is. So let's dive in and see what's really going on inside your body. And to make this super clear, the Women's Health Clinic came up with this brilliant but simple idea, the 3 biological clocks. Think of it as a framework. It helps you understand that different parts of your body heal at totally different speeds. And once you get that, managing your expectations becomes so much easier. All right, first up is this structure clock. This is for treatments that target collagen, like laser or radiofrequency. Now, what's fascinating is that your body's first move is to lay down this kind of weak, temporary collagen. But the real good stuff, the strong, supportive collagen, that takes about 12 weeks to build. So judging your results before that 3-month mark, it's literally like walking out of a movie before the big finale. You're missing the whole point. Next, we have the sensation clock. This one is all about nerve function. Think treatments like the O-shot. And here's a fun fact. Nerve regeneration is officially the slowest healing process in the entire human body. We're talking about a snail's pace of about 1 millimeter per day. So any improvements you feel are going to be really gradual, creeping in over months, not days. And clock number 3 is the mucosa clock. This is for treatments using topical estrogen. And this is a huge misconception to clear up. Estrogen is not a lubricant. Think of it as a growth signal. It's basically telling the cells in the vaginal lining, hey, it's time to thicken up and rebuild that protective barrier. You might start noticing a little something after 3 or 4 weeks, but for the full, complete effect, you're looking at up to 12 weeks. Okay, so let's quickly recap with this handy chart. You've got the structure clock for collagen, that's a 12-week game, the sensation clock for nerves, a slow and steady 1 millimeter per day, and the mucosa clock for the lining, which can take anywhere from 3 to 12 weeks. See? Each one has its own unique, totally predictable schedule. All right, now that we have these 3 clocks in our toolkit, let's do some myth busting. This is where we can really start to separate what's actually happening from what you think might be happening. Okay, this first one, I bet a lot of you can relate to this. You might hear someone say, I felt tighter right after the treatment, but then it went away. Did it fail? It's such a common worry, so let's unpack what's really going on. Here's the deal. That immediate feeling of tightness, that's not the result. It's just swelling or edema from the procedure itself. It's totally normal, and it'll fade away in about 3 to 5 days. The real results, the deep structural changes, are quietly happening in the background, following that 12-week structure clock. So if you feel things dip a bit after the first week, don't panic. It's all part of the plan. And then there's the flip side of that coin. What if you're a month in and you feel, well, nothing? It's so easy to feel discouraged. To think, oh, great, it didn't work for me. No, not at all. Please don't think that. Remember what we said? This is a slow burn. The most significant work is being done deep down at the cellular level, way before you'd ever be able to feel it. In fact, tons of women report feeling very little at week 4, but by week 12, bam, they see a huge improvement. So patience is everything. Okay, so we've got the timelines down, but this isn't just about waiting around, right? The cool part is you can actually play an active role in all this. You're not just a passenger. You can help your body get the best possible results. And it really comes down to 4 simple but super powerful steps. 1, hydrate, hydrate, hydrate. Your cells need water to regenerate. 2, give your body the right fuel. Plenty of protein, vitamin C, and zinc are the building blocks for collagen. 3, and this is a big one, avoid smoking. Nicotine just wrecks the healing process. And 4, just be gentle, use lubrication, and avoid any trauma while things are healing up.
Look, if you remember one single thing from our chat today, please let it be this number. 12 weeks, 3 months. That is the magic number, the gold standard for when you can really judge the peak results for structural treatments. Patience isn't just a nice idea here, it's a biological requirement. And of course, we have to talk about safety, because that's number 1. Now, complications are really rare, but you absolutely need to know the red flags. If you experience any severe or worsening pain, any unusual bleeding, an offensive discharge, or a fever, don't wait. Call your doctor immediately. So, when you boil it all down, healing isn't magic. It's science. It's a predictable biological process. Your body is amazing. It knows exactly what to do. It just needs the right nudge and the right amount of time. Now that you have a realistic timeline, the only question left is it time to start your clock?